Did you know that the majority of patients I see are struggling with mental health issues like depression, anxiety, and maybe they don't even know that they're suffering from it? Hi, I'm Dr. Emily Hecker with Enlightened Functional Medicine, and let's talk today just real quickly about if functional medicine can benefit and help anxiety and depression. So, there's a couple questions that I like to think about when we're looking at this. The first one is what affects the brain? We need to be thinking about that in terms of mental health. What's going to affect the brain? Physiologically, what's going on there? One of the things that functional medicine looks at that traditional medicine does not typically look at is what foods are you eating that's causing inflammation that causes the brain to malfunction. So, certain things, certain inflammatory foods can be very damaging to the body and can affect. You might have heard of the term when the gut is on fire, the brain is on fire, or maybe you haven't. But it's common, and it's in the literature, that inflammation in the digestive tract can affect the blood-brain barrier, affecting the neurotransmitters that go on in the brain. So certain lack of nutrients can occur due to inflammation. And especially when we think about mental health disorders or struggles that we're dealing with, what deficiencies are going on? That's usually the question that a lot of doctors will look at is what's going on? What is the serotonin level? Do we need to make sure that serotonin stays in the synapses longer so we can get all those good feeling chemicals produced in there? So when we think of the nutrients, we think of serotonin, dopamine, maybe GABA. With that, we look at medication, and the traditional medical model looks at that way. We also need to consider what minerals and vitamins maybe you are deficient in. And this is something that functional medicine will look into. What nutrients are you not getting that's causing the brain to not work as good as it could? We like to look at different tests in functional medicine this way. What tests could be done? What data could be gotten that we can look into discovering and figuring out what's going on with the inability to modulate the moods properly? Certain tests I like to run as we look at the whole picture, the whole person, is going to be one, stool testing. What is going on with the gut environment? Are you digesting properly? What is the stool? What is the microbe content? Are there pathogens going on in the body that shouldn't be there that need to be eradicated to help this whole microenvironment of the digestive tract to work effectively? So there's other tests we can do, like micronutrient tests. A micronutrient test is going to look at, it's a blood test that looks at the nutrient status outside in the plasma of the blood, as well as inside the blood cells. What's going on outside, what's getting in and going through that membrane to get the nutrients into the cell that we need to. Other tests that we can consider would be basic blood work, really, looking at a CBC, a CNP, a lipid panel, looking at all the different details of that, an iron panel, a thyroid panel, what's actually going on in there that can affect the brain function. Everything can be connected with this. There's also genetic testing that we could look at to see what genes, what polymorphisms that you may custom have based on mom and dad gave you, what's going on with those genes and how are they working effectively? Genes make enzymes. Enzymes do things. So if there's certain things that are not being done in your body, maybe it's a genetic component. And you know what? You're not destined to your genetics. We can learn from that, and we know what things are cofactors for certain genes that we can help give and promote the function of those genes to help clear neurotransmitters and to help keep them in the synapse longer. So what comes next, right? What comes next? If you're getting this data, if you're looking at this stuff, how can functional medicine actually help mental health? Well, we need to make a plan. We need to hold that plan accountable. We need to see what's going on, check in, what's working, what's not working, so we can get better results. I'm Dr. Emily Hecker. Thanks for tuning in.